Hey, Hillary, this is a good topic for us because sperm health is so overlooked, right? It's like we always do all the exams on the women. We only do maybe a sperm analysis on the men. People are not looking closely at their labs. And so we wanted to share what we're seeing in clinical practice because we go through so many of these male labs and really connected to their fertility. And we're really trying to get the word out that this needs to be done, right?
Yeah, I think that a lot of women, and we're guilty of it too, sometimes when we're working with a woman, it's like,
Hmm.
oh, yeah, he's fine. His sperm test was fine. He's fine. But yet there's unexplained infertility.
Hmm.
And we need to do a deeper dive on the men. The men are being overlooked. The men are often taking supplements that the woman put them on or they found at the reproductive clinic or something. So many of them think they're doing it. But what we're finding when we're deep diving on a man, which needs to happen,
Hmm.
that we're seeing three really important things that we're going to unpack more, but that we need to, that the men need to be focusing more on. So that's nutrient issues, metabolic issues, that's kind of a bigger thing, and then stress and environmental factors and stressors. So,
Hmm. So I'm going to tell you about the lab that I just looked at, a client that we're going to meet with later today. And this man has been working on his fertility for a long time, actually. They've been trying to get pregnant over 3 years. And
well, the couple's been trying to get pregnant.
yeah,
Yeah.
so he's been working on this. And he's doing diet, he's doing exercise, he's lost all this weight. He's awesome. He's really doing a lot of work. And then you and I just got our first set of labs back for him. And it was striking that this man, he's taking supplements that the fertility clinic recommended, and he is actually taking them. He doesn't skip days, and he's truly deficient in key nutrients. So you and I are looking at this saying, how is he B12 deficient? How is he folate deficient? And why has no one ever looked at this? He has omega-3 fatty acid deficiency, and his stress hormones were totally off in the lab. So this is, where we said we need to start talking about this in a bigger way because he thinks he's doing everything right. They're still not getting pregnant, and we're concerned.
And the male factor is very, really important factor. Like Kara always says, you have one shot to get the best genetic material to the dividing embryo, and that turns into the baby. Like
Mhm.
we need to make sure this is optimal. And if a woman is unexplained, the man needs to be buttoned up. And I think that's such a fascinating thing. People think they're doing enough, but they're in
Mhm.
the end not. And the lab work isn't being followed up on with him.
Because the sperm analysis that you just do, it can look normal, but it doesn't really tell you about what's the quality of that sperm. And it's not that hard to change that quality is what we see in our clinical practice, because it is that one cell that the man's giving, it's like that one opportunity. And a lot of the way that I think about that came out of looking at the research on older men, men over 55 and over 65, and men who are older and what happens to the health of their babies, and just making note of, oh, they have more ADHD, they have more neurodevelopmental issues. And what is that about? Like what does that mean? They can have a normal sperm analysis, but the health of the baby's different. So what can we do now in prep is what we're all about when we're working individually with people. So the nutrients, absolutely important. Folate and B12 are about cellular division. It's important for us to note, and we see this in so many clients, right, Hillary, that those things are depleted when people have a lot of stress.
Yeah, so we said nutrients. So there's these key nutrients that are
Mhm.
needing to make sure that are robust, not just like enough. That the metabolic factors, that's what Kara was talking about, the stress hormones. If there's weight gain, if it's impacting thyroid. Sometimes women are their thyroid's really being managed and controlled, and the men are like out there doing whatever they want, and we check their thyroid function and they're slightly hypothyroid or they're underactive in their thyroid function, which is also contributing to a little weight gain, which is contributing to a little bit of inflammation. And all these things add up to make it so the sperm aren't as effective. And it could be a factor. So if we're looking at all the different things that could be, and that's the dance in unexplained infertility, we're like, okay, it could be a little bit of this, a little bit of that, a little bit of this, a little bit of that. And you're trying to make each ingredient optimized so that the end product is the most delicious it can be, right? So stress and the metabolism, the metabolic factors are really important to look at for the man. So that's stress hormones, thyroid hormone. And then kind of that third part is, what are they being exposed to regularly? Their toxins, their cookware, what are their practices at work? If they're out of the home for a big part of the day, what are they being exposed to? Are they taking enough antioxidants are they doing a ton of airline travel for work? If so, are you compensating for that lifestyle shift to make sure that the sperm have a fighting chance in this fertility game
Yeah,
dance?
so absolutely taking a deep dive in labs for male fertility is so, so, so important. So we hope you do that.
Anyway, we're going to unpack it a lot more with a longer talk, but we just wanted to get you excited about that.
Mhm.
The men really matter. See you guys soon.